So shall we start? Nice. Hi, good evening, everyone. Firstly, let me extend a warm welcome to all of you here. As I said, it's a long-expected get-together here in the Chinese mission. As I promised, I didn't remember 4 months or 5 months ago. But eventually, we gathered here. And I'm just wondering, the setup is somewhat different from the palace. So I'm just wondering, I might look all right? I mean, everything, the background and everything. So today with me, we have the health counselor, Mr. Feng Yong, and also the counselor for human rights, Mr. Jiang Yingfeng. So if there is a need, I hope that he could jump into the stage to lend a helping hand. But I'm ready to share with you some of the basic ideas. Basically for two things. One is the coronavirus. We have distributed some of the fact sheets to make the long story easier for you and for me. And as you know, the 43rd session of the Human Rights Council is approaching. We have started actually start with the high-level section next week. So I wish to share with you on some of the initial ideas we had. So firstly, on the coronavirus, actually, as you know all, this is a grave test, not only for China, but for everyone in the world, for every country, for the whole international community. I should say we will stand the test, and we are confident because of the strong leadership, because the capability of China to mobilize, as you see, the whole nation, to work together to fight against the spread of the virus. So, and also thanks to the international community's solidarity and support. And also, we, as I said last time, we have enough resource and in terms of organization and in terms of scientific research. So eventually, with the joint efforts, we will win the battle. So actually, since the very beginning of the virus, the Chinese government has always put the life and health of the people at the center, given full play to its system advantages, and implemented, as everybody observed, the most forceful and decisive and strict prevention and control measures in terms of epidemic surveillance, in terms of case management, in terms of close contact management, laboratory testing, medical supplies, and scientific research. So with all these efforts, we all witnessed that positive outcomes has been achieved as indicated in the fact sheets in front on your seat. So as a result, the numbers of cured cases nationwide has increased rapidly, and the number of discharged cases is more than 1,000 for 8 consecutive days. And the newly diagnosed cases across the country, of course, except the Hubei province, shows a downward trend for, until today, already 16 consecutive days straight. From the highest of 890 people on February the 3rd to 45 on February the 19th, that is yesterday. Yesterday, all provinces and cities, except Hubei, have reported less than 10 cases. And no confirmed cases was reported in many provinces. The national fatality rate for the disease is around, at this point, 2.8%. And the rate for the provinces outside Hubei is around 0.7%. So the proportions of severe cases in Wuhan city, in Hubei province, and nationwide are all decreased significantly. At present, increasing hospitalization and cure rates and reducing the infection rate and the mortality rate are still on top of the list as top priorities. you will find Hubei province, especially Wuhan city, will be the decisive place to win the battle against the epidemic. Currently, more than 200 medical teams and 30,000 medical personnel from all over the country and 3 mobile laboratories have been deployed to support Hubei's efforts to fight against the disease. The vast number of staff, medical staff, who are fighting on the front line show their great dedication, professionalism, and a high sense of responsibility. I share you with one story that is on February 18th. The Lancet, it's a publication, it's a magazine, very famous in the medical field, published a correspondence online entitled Statement in Support of the Scientists, Public Health Professionals, and Medical Professionals of China combating COVID-19. 27 well-known public health scientists from 8 countries signed that statement. We highly appreciate their voice of support. Since the very beginning, China has maintained an open, transparent, and responsible attitude to cooperate with the international community, including share information and viral journal sequence in a timely manner. We invited Dr. Tedros, of the Director General of the World Health Organization, to pay the visit to China, and I personally was part of the visit. We're very much encouraged by the mutual trust, by the joint endeavor to try to cope with the spread of the virus. So we have taken various measures to solve the difficulties faced by the foreigners in China and providing support to countries with vulnerable health systems through multilateral and bilateral channels. As you know, the China WHO Joint Expert Mission is currently started its work in China. They have paid field visit in Guangdong and Sichuan province, and they will make recommendations and suggestions on how to prevent and control of the epidemic, not only in China, but also in the world. As of today, 1% of the total confirmed cases were reported outside China. So China's prevention and control measures not only protected the life and health of the Chinese people, but also buy time for the world, for the global preparedness. So I'm grateful that the tremendous effort of China has been highly appraised by the international community, of course, including by Dr. Tedros of the World Health Organization. And it is really very much encouraging that the leaders from more than 160 countries and 30 international organizations have expressed their sympathy and support. I thank them for all this solidarity. At this moment, we need to, more than ever, to take an objective, rational, and scientific attitude towards the epidemic in terms of both prevention and control. So we hope that all players could follow the professional guidelines of the World Health Organization and simply to avoid the over-panic and overreaction and excessive measures. China will continue to work closely with WHO and other countries by grasping the window of opportunities to defeat the epidemic as soon as possible. So I wish to quote Dr. Tedros by ending my brief remarks. This is a time for facts, not fear. This is a time for rationality, not rumors. And this is a time for solidarity, not stigma. So I will stop here for the coronavirus. Since I was here, since the 43rd session of Human Rights Council is approaching, So I wish to share with you some of the basic ideas. As you know, China will be weakened for this year, so we are not members for this year in the Human Rights Council. But we are ready to continue to participate in the work in a constructive manner in the Human Rights Council to make our own contributions in a status as observer. We are ready to conduct any kind of meaningful dialogue. So 3 points is important as far as we are concerned. Firstly, we need to enhance dialogue and cooperation. So we wish to see a healthy and a sound, stable, sustainable development of the international cooperation in the field of human rights. We don't wish to say the practice like naming, the shaming, and the public exertion of pleasures will be continued. As I said, we are ready to conduct a meaningful dialogue on the basis of equal footing and mutual respect. But we don't believe the style, the microphone diplomacy is the right approach. So we will again put forward a draft resolution entitled Promoting Mutually Beneficial Cooperation in the Field of Human Rights, to call the more cooperations and a dialogue in a multilateral human rights area so as to achieve a win-win situation. Secondly, we believe it's of paramount importance to respect the development path or road of countries independently chosen by their people. So as I shared this idea with many occasions with you and with many European partners, that the universality and fundamental freedom is like the ultimate goal, is on top of the mountain. So there's no doubt that we share the same ultimate goal. But we need to allow each and every country to take its own path based on its different specific national conditions. So we hope that the Human Rights Council will conduct its business in a fair, objective, and non-selective manner. We don't believe it will be advisable to impose a single model or single road to the top of the mountain. We don't believe that is the right approach, because this method itself is not democratic. Last but not least, we wish to see the advanced human rights in all its dimensions. We wish to see, as one of the developing countries, we wish to see more focus or attention could be paid on economic, social, and cultural rights, and of course, the right to development. We wish to see more attention will be paid on those issues which developing countries have focused over the years. That is the hate speech, the rights of migrants, and the counterterrorism and the de-radicalization, etc. So in the upcoming 43rd session, as far as China is concerned, let me put it this way. Our participant could be also summarized as a multidimensional exercise. Firstly, to promote mutually beneficial dialogue. Second, to defend our own interest, because we don't believe, as I said earlier, the microphone diplomacy is the right approach. So we are not going to provoke any irresponsible remarks to the others, but we have to prepare ourselves to any possible scenario. Then the next front is we will actively participate discussions in the country's specific resolutions, a country-specific agenda item, that is item 4. As you know, a number of countries will be concerned, so we will be actively participate and render mutual support among developing countries. So that is roughly the basic ideas. And I know many of you follow very closely the situation in Xinjiang Uyghur Autonomous Region. And you will find in BBC, CNN, a new round of attack, try to demonize China's policy and practice. And actually, what happened in Xinjiang is not the issue of religion. It's not an issue of human rights, but it's to try to cope with the violent terrorism and anti-secessionism. So we have many occasions ahead of us to have in-depth studies, in-depth exchange of views on this front. So that is roughly the two dossiers I wish to share very briefly at the outset.